Hi, and welcome to Behavioral Therapy. Today I will be introducing a patient by the name of Janet. She's a 33-year-old woman that has several problems of communication with her family, is addicted to cocaine, and has had legal issues with theft. Her life has not been easy when she was married, but once she found out her husband was cheating on her, things drastically worsened. After this is when Janet began using cocaine and stealing. She explained that she needed to steal in order to support her children and the addiction of cocaine. Gathering information and studying Janet's case, I believe that the past may have influenced why Janet has been making poor decisions about her personal life due to the divorce. The effect of cocaine in Janet's brain could have possibly destroyed chemical messengers of neurotransmitters, which could be causing the lack of communication with her family and making unpreposterous decisions. Together we will work on some ways to change the behavior of the client to better herself and set obtainable goals. We will use the ABC model to help the behavior change from reoccurring and teach the client of what issue she is having to work on them in the session and while she's home alone. The functional assessment of behavior model works with antecedent, behavior, and consequences. Janet's antecedent is the use of cocaine and her divorce added. The behavioral part is problems with her children and theft. She then proceeds by moving in with her new boyfriend, that is a drug dealer. Consequences of her behavior was the escalation of the problems at home with her kids and possible imprisonment for the continuation of theft. In order to fully be able to help our patient, Janet, we will use the following techniques that were thought out specifically for this case.
Hi, my name is Natalia Rodriguez, and me and my partner decided to go with the behavioral therapy approach for our client, Janet. I'll go into talking about some of the techniques used in behavioral therapy, ours specifically, and our reason for choosing it. One of the techniques would be operant conditioning techniques, which involves positive reinforcement, negative reinforcement, which is used when we want the behavior to increase. We also go into extinction, negative punishment, and positive punishment. Those are used when we want the behavior to decrease. Therapists tend to stray away from punishment and rather use reinforcement to change the behavior. There's also progressive muscle relaxation. It's aimed at muscle and mental relaxation. Another one would be systematic desensitization, which clients expose themselves to anxiety-arousing situations and act in a way that contradicts that anxiety. There's also in vivo exposure. We expose clients to life anxiety-arousing situations, but they imagine it. Flooding, in vivo flooding, is prolonged exposure to anxiety-arousing situations, and imaginal flooding occurs in the patient's mind. Eye movement desensitization and reprocessing. It's for clients that have experienced traumatic stress, undergo rapid rhythmic eye movements and other bilateral stimulus. Then there's social skills training. It allows individuals to interact with others under different social conditions. And self-management program is the one that we chose. It's self-monitoring, self-rewarding, self-contracting, and stimulus control. So we chose the self-management technique. We start off by letting the patient select goals for themselves that are attainable. Then from there we'll work on translating those goals to behaviors. We also want the patient to keep a diary of their behavior, noticing antecedent cues and consequences so we can see what causes the behavior and what comes out of that behavior. Then we work on a plan for change with the client. And from there, we'll have the client evaluate their plan and see if they're reaching their goals and they're on the right track. We chose this form of technique because it empowers the patient to monitor their progress, it allows them to reward themselves, and it gives them control over their life rather than being dictated by the therapist. Janet suffers from addiction abuse, so this is a good technique for her since drug abuse kind of takes over the patient's life. This allows her to regain her life back and set goals to achieve her family's love in return and also get away from the cocaine addiction. We used Theories and Practice of Counseling and Psychotherapy book as our references for this presentation. Thank you for watching, and I hope you enjoy our role play. Hi, Janet. How are you?
I'm doing well, thank you.
My name's Natalia, so tell me a little bit about yourself.
Well, I'm currently 33 years old. I have 3 kids, 2 girls, 1 boy. And I've constantly been having arguments and fights with my children. And to make matters worse, once I divorced my husband, he disappeared. He then reappeared and decided to take my son away from me. Away from all that, I had gotten into some trouble with the law and from stealing and the use of cocaine. The therapy here for me is a requirement given by the court in order for me to have parole. So I wouldn't have to sit in a cell and not be able to see my children. The use of cocaine helps me relax and just go away from all the problems that I have at home and with other issues.
So what I want to know is, how did you exactly come about the use of cocaine?
Well, I started using cocaine when I met this guy about 4 years ago at a quick stop. He began flirting with me, and since then we started dating. He offered me the drug at no charge, and that's when I became addicted and could not go a day without using it. When we broke up, he began charging me for the cocaine, and I had to resort to stealing in order to pay for my addictions and support my children. I then met Julio, who also is a drug dealer and currently moved in together with me. Since we moved in together, there's been a lot more problems at home with myself and my children. I need help and I don't know what to do.
Okay, Janet. So in behavioral therapy, we like to use the ABC model. A stands for antecedent, B stands for behavior, and C stands for consequence. From what you've told me, your antecedent, would be the separation and the fact that your husband left and then he came back and he took your son. This led to your behavior of stealing and resorting to cocaine to soothe your emotional distress, which then led to the consequence. Your behavior led to the consequence of the tension that was created within your family, and also the threat of going to jail as well. So what I want to work on is setting goals that are attainable for you. And then I will go on to explaining a little homework assignment I have for you. So what would be some goals that you think are in your reach?
I think that perhaps I should start by looking for a job, find a rehab center to help me with my cocaine addiction, find a way to break up with my current boyfriend to help with the issues at home with my children, and find a way to have a civilized relationship with my ex-husband to better the relationship with our family and our children.
Okay, those are great goals to have, and remember, they are your responsibility to keep. These goals will enable you to target the behavior, such as drug addiction and stealing, to better your relationship with your kids. Now, what I want from you for our next session is to keep a diary in regards to your behavior and how you observe the antecedent cues followed by the consequences. And then in our next session, you will devise a plan for change. And after a couple of sessions, you'll be able to evaluate your plan and see if your goals are being met. How does that sound to you?
It sounds good.
Okay, so do you have any questions on the behavioral diary?
Yes, actually I want to know a little bit more thoroughly exactly what has to be written in these diaries.
Okay, so what I want from now on to your next session is just to be keeping a diary of your daily behavior, and also keep in mind as to what caused your behavior, the antecedent cues, as well as what happened as effect to your behavior, the consequences that came from the behaviors you made. Also keep in mind your goals while you're doing your behavioral diary to see if you're meeting them as well. Do you have any more questions?
Yes. Do I have to include anything outside of the issues that I'm having? Because what if I run into extra issues?
Write them down as well. We like to see what is affecting you. That way we can have a better evaluation of your treatment.
Okay, that sounds good.
Is that all your questions?
Yes.
Okay, perfect. Well, it's been a pleasure working with you, and I shall see you next time for our next sessions. Remember, it is your responsibility to keep your behavioral diary and make sure you are acting accordingly to the goals that you have set for yourself.
Okay.
So thank you so much. It's been a pleasure.
Okay. Likewise.